Hi, this is Dr. Zanis in New Bern, North Carolina. At the Zanis Center for Plastic Surgery, one of our top procedures is breast augmentation. It occupies at least 50% of what I do, if not more. And more patients are finding out about the ease of breast augmentation and the great changes that it can have and effect it can have on your life and your self-esteem. So when we see so much interest and a lot of patients coming in asking about this procedure, there's a lot of frequent questions that are brought up and a lot of things that I bring up because they're important for you to know. One of the most common is, what implant should I pick? Size is another issue, and we'll discuss that probably in a different video, but I'm talking about what type of implant, saline or silicone. And I have used both many times, as most breast surgeons have, and there are some advantages to both. However, with the current generation of silicone gel implants, I think that they are far superior to the saline implants out there for many reasons, which I will share with you. And the silicone gel implants, my preferred brand is Sientra. I think that they make a superior product, although Allergan and Mentor both have similar implants which have many of the same benefits. We prefer Sientra for many reasons, predominantly the performance of the product and the quality of the company. And why do I think silicone is such a good choice? Why would I recommend silicone be used for a family member, my wife, a friend, over saline? Because number one, they feel way more natural than a saline implant. Most people want it to look natural and feel natural, and silicone will achieve both of those. Silicone gel implant of today is composed of a cohesive gel material that is fused to the shell and is like a semi-solid. That's why it gets the name gummy bear. You cut a gummy bear candy in half, you will find that the two sides can be separated and they maintain their individual shapes. The same thing has been done, and I've done and demonstrated before, that it can be performed on an implant, and the implant halves will maintain their shape. The benefit of this is long-term durability. You will find that silicone gel implants being used today will most likely last 20 to 30 years down the road, and that's a pretty realistic estimate. I've had very few problems with them in the past 5 or 6 years. And in addition to the feel, the look, the durability, then you have to contrast that to the disadvantages of saline, which are very commonly rippling and visibility of the implant, palpability of the implant, sound of the fluid inside of the implant. Really, a saline implant is just a glorified water balloon, which has had successful outcomes in many patients, and occasionally I will use if someone has an existing saline augmentation with a rupture or deflation and doesn't want to replace both but just fix the one that broke. But in general, first-time augmentation is going to benefit tremendously by using the best implant there is, and I think that the Sientra silicone gel implant is by far state-of-the-art and above all the rest. And so 99% of what we do here at the Zanis Center is going to be that.